Hello, I'm Valerie at Dr. Kim's office. I'm here to go over some of your post-operative care. We went over some instructions with you today in the office, and you were given a written form that went home with you. So we're just going to review this together in case you had any questions that maybe you forgot or weren't answered for you. When you left today, you possibly had a surgical dressing placed in your mouth. This is that oral bandage that kind of looks like silly putty or bubble gum in the mouth. If for some reason it's already fallen off, that's okay. There's no need to contact our office. Ideally, it would stay on until your next appointment with us post-operatively. It is covering the surgical site that we worked on and the sutures that may still be intact. These sutures that were placed are dissolvable and most times dissolve on their own before we see you next in the office. If at any time the sutures happen to come untied and are bothersome in any way, you may gently trim them back with some sterile scissors or nail clippers. We do ask that you do not tug or pull on the sutures in any way, shape, or form. If you're uncomfortable doing this yourself, you are welcome to call our office to come in and we will be happy to do it for you. As far as your oral home care goes, you are going to brush and floss your mouth normally in all areas that we did not work on today. Any surgical sites that were operated on that do have sutures or the oral bandage you are going to avoid. You were given a prescription most likely for oral mouth rinse, and we, per the prescription on there, you're to use that 2 times a day. Sometimes it gets a little confusing for patients because it does tell you to omit toothpaste. We do tell you to not use toothpaste that has fluoride in it. Fluoride and the ingredients in the oral mouth rinse do not like each other. So if you're going to use the rinse, you need to wait an hour in between brushing with fluorinated toothpaste. Sometimes this isn't convenient for everybody, especially in the mornings, so you can omit toothpaste altogether and use the rinse as your toothpaste, basically. You can stick the toothbrush in the rinse, brush your teeth normally, and go about your day. At nighttime, it might be a little bit more convenient for you. You can go ahead after your meal for the evening, brush with your toothpaste in all the areas we did not work on, do the rinse last before you go to bed. You are welcome to do warm saltwater rinses as much as you would like throughout the day. The instructions on here specify the amount of salt to lukewarm water. You don't want it too hot or too salty. It is common to have some swelling to the surgical area. A lot of times if this is going to happen, most patients won't see this till the 2nd or 3rd day. Everybody's different, so don't be alarmed if you happen to get any bruising or swelling. We do send you home with an ice pack the day of procedure and advise you to use a cold compress as much as you can throughout the day. 15 minutes on, 15 minutes off. Not too much pressure is needed, but enough to make it comfortable. The pack that we send you home with only lasts for about a half an hour, so once you get home, you can get a Ziploc bag, apply some ice cubes and some water, and just get a wash rag or a soft cloth that you can wrap it in. It makes it a little bit pliable, and you can place it on and off as much as you can in the first 24 hours. Usually after the first 24 hours, it's no longer necessary. You were prescribed some pain medication, most likely an ibuprofen and a stronger pill of ibuprofen. Some patients' needs are a little bit different depending on your medical history, so if your drug prescription was a little bit different, that's okay. But primarily the ibuprofen is given for the minor pain and discomfort and is great anti-inflammatory. So we do advise, even if you are comfortable, to take the ibuprofen as needed every 6 hours. As far as any patients that were seen in the office today that were under any sort of conscious sedation or possibly giving your medical history or taking any other medications along with the procedure, usually within the first 24 hours we ask that you kind of be monitored and not left alone. Make sure you're feeling okay. Make sure you're resting as much as possible in the first 24 hours and not doing any strenuous activity that could hinder any of the procedure that we did today. Sometimes overactivity can cause drainage from the site and make you feel a little off. So we do ask that you take it easy, Make sure if you're going to the restroom or taking the dog out for the walk or doing anything that it's very minor, and that you make sure you get your bearings about yourself and you're feeling well. Don't jump up to answer the phone or run to get the doorbell if the UPS man's knocking. If for some reason you do have some drainage from the site, it is considered normal. The only time we're overly concerned with bleeding is if you have any clotting. And our definition of clotting is if you have any golf ball sized clots of blood coming from the site that we worked on today. If that is present, we do ask that you call our office and inform us, and we would give you further instruction from there. Some minor drainage from the site is considered normal and completely okay. If you did happen to have a surgical extraction today, or the site seems to be draining a little bit heavier than normal, you are able to get a tea bag like you would make iced tea or a hot cup of tea, like a Lipton, any brand, kind of regular tea bag. You can dampen it under the faucet and kind of wring it out, set it in the area, and apply some gentle pressure to it for about 30 minutes. The acid in the tea will help form a clot in there. Hopefully this will work for you. Again, if it doesn't and you're concerned with the drainage from the site, please don't hesitate to call our office. As far as your diet goes, one of your main instructions is to stay on a softer diet. We want you to avoid abrasive foods, meaning potato chips, crackers, pizza crust, anything that may poke, puncture, or harm the area that we worked on today. Softer diet, think your comfort foods, mashed potatoes, macaronis, fishes, ground beefs, anything you don't have to make a strong effort at chewing. We want to give the surgical area some time to rest and not do any overactivity in the mouth. It also helps protect the area. So we advise you to stay to a softer diet for the next week. On top of that being said, it's very important that you avoid suction to the mouth. So as much as you want to go home and have a smoothie or a Frosty, make sure you don't use that straw. They give you a spoon, so make sure you use it. So no straws, spitting, smoking. Any suction to the mouth is going to want to open the clot that we're forming in the mouth, hence any drainage that you may or may not have. So we definitely want you to avoid the suction to the mouth. Stay on a softer diet. If for any reason you had to stop any special medications for your procedure, we would have advised you on when you are okay to start those back. Usually it would be the day after procedure, as long as no complications have arose. If you're uncertain, please call our office to verify when you need to go back on aspirins, blood thinners, or any special medications we advised you to stop. As far as that, the back of your post-operative instructions at the bottom will have some phone numbers. You do have our office number. It is 386-322-4867. Dr. Kim's personal cell phone number was also given to you for emergency purposes if after hours. If for some reason you cannot contact us and you feel that you are having a medical emergency in regards to the procedure you had today, please be sure to call 911 or go to your local hospital, and we will be notified.